Now, when are we as orthopedic surgeons suspicious of an ACL injury? Certainly, sometimes a history will hear a patient say they heard a pop or they will sustain an injury. It could be a tackle in football. You may plant and the patient may have lots of pain. So we'll do a physical examination. Obviously, we get the history from the patient, getting a better understanding of what happened at the time the pain started. Then we do a physical examination. There may be swelling around the knee. And, people can have chronic swelling or long-term swelling. But if a person has acute swelling, sometimes that can be an indication of an ACL injury. We look for instability on exam. There's an examination we call a Lockman's test or a Lockman's maneuver, where we attempt to shift the tibia or the shin bone anteriorly in relation to the femur or the thigh bone. And it should not be a lot of laxity or looseness when we do that examination. That could be indicative of an ACL tear or anterior cruciate ligament tear or injury. The confirmatory study most often chosen, though, is an MRI because an MRI shows great detail with the amount of swelling in the knee. It can show other factors and damage in the femur or the tibia, may pick up injuries to the menisci, etc. But the MRI is a great test to order looking for an ACL injury. Some people would choose to get an ultrasound if that's more readily available and may still choose to get an MRI as a more confirmatory or a backup study, really depending on access to what type of medical facilities and care that you have in your particular area.